I'm now delighted to welcome our next speaker. Dr. Robert Gabrys is a research and policy analyst, and he's going to be providing us with an update on the state of cannabis research from the Canadian Centres on Substance Use and Addiction. Thank you, Dr. Gabrys.
Thanks, Jason. Hello, everyone. I'm just going to share my slides here. Okay, so as Jason mentioned, I'm a research and policy analyst at CCSA, and I do a lot of the research around cannabis at our organization. Before beginning, I just wanted to quickly acknowledge that the CCSA offices and my home are located on the traditional and unceded territory of the Algonquin and Anishinaabe Nation. For those who don't know a lot about CCSA, so we were created by an act of parliament in 1988 to address substance use in Canada. And to this end, we do quite a bit of monitoring and surveillance work around substance use and related outcomes. And this also includes doing a lot of synthesis around various topics related to substance use and dissemination for various audiences. As a national organization, we also serve to amplify important issues within Canada and coordinating collaborations across various stakeholders in order to address important issues around substance use in Canada. And ultimately, our goal is to make sure that the substance use field is equipped with the necessary knowledge and resources in order to deal with issues in a timely and effective manner. So we do have quite a bit of different priorities at CCSA. A big one for us currently, in addition to cannabis, is actually our alcohol work, where we're updating the low risk drinking guidelines, so that you could look forward to towards the end of the summer, early fall. So we also do a bunch of work on children and youth, on stigma, on opioids, workforce development, and of course on cannabis. So that'll be sort of the topic for today. So we don't have a very large research team, but we do work with a lot of different researchers across the country in order to develop a wide array of different knowledge products for a whole bunch of different audiences. And one of our flagship knowledge products is the Clearing the Smoke on Cannabis series. So that is a series of 7 reports that reviews and synthesizes the current evidence on cannabis across various aspects of health and functioning. And we are actually currently working on our report, updating our report on medical cannabis use and cannabinoids. And that report will be available at some point at the end of the summer. In addition to tracking that sort of research, so we've been ever since cannabis legalization, we've also been producing an annual report looking at progress towards the Cannabis Act's public health and safety initiatives, and we're releasing a report on that with a 2021-22 update in the next month. So in addition to that, we do quite a bit of qualitative work at CCSA, and including within the cannabis space, where we just finished a focus group study looking at perceptions and attitudes about cannabis among people who use cannabis frequency. And our interest there is to see whether attitudes and beliefs around cannabis differ among those who use frequently versus those who use less frequently. And finally, we just started a pretty big project looking at cannabis use among older adults. So it's almost like a 2-phase project it's a quantitative component looking at prevalence rates of cannabis use, frequency of use, methods of use among individuals who are 60 plus. And then there's a qualitative component in phase 2 looking at more of the same style of like perceptions and attitudes among older adults, and whether again they differ relative to younger age groups. So that report should be also probably released sometime in the fall. So Nina spoke quite a bit about some of the work that we're doing around the Catalyst grants and the PCPE grants. So I'm going to sort of skip that. We do have, or CIHR has posted a report on their website around that funding opportunity. In addition to that, we funded 19 projects through our Closing the Gaps research, and that was in collaboration with the Mental Health Commission of Canada and Health Canada, and that sort of covers a wide variety of different topics. So obviously mental health is a big one for us in that area, but it also, we've also funded a few projects to examine whether legalization has affected different priority populations differently, and how that sort of different regulations from one province to another impacts various harms and safety issues there as well. And in January of 2018, in collaboration with the Public Safety Canada, we ran a research symposium looking at how legalization has affected public safety in Canada and the legal system. And that report is available. We recently actually released that report. It's available on our website. And so we could see here that we funded quite a bit of projects over the course of the last 4 years. And in doing so, we created a database on our website, a Canadian cannabis research database that sort of synthesizes all of these projects across different sort of indicators. And I would suggest that you check that out for sure. And finally, so within our knowledge mobilization team, ever since cannabis was legalized, and especially around the legalization of some of the new products, we've been supporting Health Canada in terms of public education. And most recently, we've been doing a lot of work around vaping. So we do have a few videos on YouTube around vaping, and also a talk, like a toolkit for people to be able to speak to youth about vaping. A big priority for us for this year is around cannabis use during pregnancy and breastfeeding. So we've done several knowledge products around that, and now we're working on several others looking at cannabis use for medical reasons. In addition to public education, we have a lot of work actually to do in terms of mobilizing knowledge around the PCPE and Closing the Gaps grant. So we do have a large promotional plan around that, and stay tuned to see that. And finally, we recently released a self-assessment tool for cannabis use. So this is a harm reduction tool looking at ways for people to assess whether their cannabis use is risky or low risk, and ways to reduce risk. So that knowing your limits on cannabis guide has recently been released, and we're currently in phase 2 of assessing its utility in terms of turning it into an online interactive learning module. So I know that was quick, but if you do have any questions, here is my contact information, and I'm happy to answer any questions right now.
Thank you very much, Dr. Gabrys. Are there any specific questions for Dr. Gabrys right now? Again, if any questions do come up, please write them in the chat, and Dr. Gabrys can answer those as we go. Great.
Okay, thanks so much, Rob, for that presentation.